Rufai, Special Advisor to the President on National Economic Council, NEC, and Climate Change. She's also Acting National Coordinator, HCD2. We're glad you could join us on the program.
Thank you for having me as well.
We also have with us right here in the studio Dr. Ahmed Abdul Wahab, a strategic advisor on Human Capital Development 2.0. Many thanks for joining us for this conversation.
Thank you.
All right, yeah.
All right, so let's just begin by first of all trying to understand what we mean. You know, for some people, we're talking about Human Capital Development Index. It's maybe strange. So I like Dr. Abdul Wahab to tell us what exactly is this Human Capital Development Index and why is it important, you know, in the development of any nation.
Thank you, and thank you for the invitation. So maybe when you say an index is a measurement. Well, I think maybe it's good to define human capital. As the popular saying goes, that every nation is as good as its human capital. And then when we talk about human capital development, we're talking of making sure that the people that makes up a nation or an organization actually are able to actually perform at their optimal best. And so you have this index that you have a series of indicators that we use as a measurement to be able to see whether this human capital is optimal or not. And those figures that you quoted are some of those indices that are used to measure the human capital.
Can you make the indices or indicators more relatable now so that we all know which area, you know, are the driving positively, you know, driving our ranking positively?
Yeah. So for Nigeria, we've identified 3 broad areas. When we talk about human capital, we look at their health and nutrition, we look at their education, and then we look at labor force participation. So, and then we are also broadening it to look at aspects of gender and financial inclusion. So all these indices measure these different components. If you talk about health and nutrition, for instance, they look at what proportion of the under 5 children are stunted or they're malnourished. So you look at that one. So if you have a very high number of children that are malnourished, your index will be low. Then they look at under 5 mortality rate. That's the number of children that did not live up to their 5th birthday. So if your number is very high, as we have in this country, if the number is high, then your index is going to be low. So then you looked at other things around education, around literacy rates, around the availability of qualified teachers. So you have this range of metrics, how many people are in employment. So when you put all these things together, then they'll be able to tell you how high or high low is your
index.
Your
all right,
index.
Thank you, Dr. Abdul Wahab. I like Rukia Erufai, you know, to respond to why the index has remained low, because reports have it that the HDI has increased 22% in 19 years, but it still remains low at 0.548. Why is that so?
So, like Dr. Ahmed mentioned, if you look at the Human Capital Development Index, it's a very long-term program with very long-term results framework. And if you look at what the immediate past NEC has done, because this is a National Economic Council program where NEC tries to play advocacy to prioritize human capital development and allocate more resources. For me, when I look at based on what I see on ground, I think even having a holistic strategy like this one that the immediate past NEC has done, you know, where you're trying to convene, advocate, and call to attention policymakers to look at it together from fetus, actually, not even childbirth. In fact, someone at the workshop, the focal point from Nasara, says to her, it even starts from the parents and you know how aligned they are, down to the survival of the mother and child, to the a human being accessing quality education, and then being able to, and healthcare, and then being able to participate, you know, positively and productively in the labor force. You look at that, you give it maybe like 50 years, up to retirement age. But I mean, human capital goes even to elderly care. So I personally think it's a results framework. And when you look at the last 8 years, the government has done a great job in charting out a strategy, at least that acts as a framework for...
But do you think the policies of government have been targeted at improving this human capital development
yes,
index?
When you look at it, policy, yes, but the challenge remains the implementation fully to be able to push us to be globally competitive. And when you look at, that's why when we did the workshop, we put together stakeholders, and what we're trying to do is push from strategy to action, and in an empowered way, because it happens at the grassroots, and that's why, you know, it's a NEC program, because the states as well, and then convening. So when you look at the last 19 years, because of the results framework, you know, I think mobilizing for action would help to improve the...
Outside mobilizing for action, a lot of people who have looked at the index of Nigeria in terms of human capital development would say that it's basically on the policies of government. Away from the federal government now, let's look at the subnationals. We see governments that are focused on building airports, governments that are focused on building stadiums, are not, you know, caring about primary healthcare development, for example, not caring about, you know, how pregnant mothers, you know, are taken care of and all of that. So that's why I would ask again.
Yes.
Away from the federal government, looking at the subnationals now, because it's not just about the federal government alone. So would you say that government understands what, you know, what human capital development is all about and incorporating it in their policies?
Absolutely. If you look at even the launch of the steering committee, you see overwhelming support. The governors stand up, and you look at how they're trying to prioritize, but the challenges still remain with the fiscal buoyancy to be able to implement some of these programs. And like you rightly said, you know, human capital, the gains are not very tangible and immediate, like an airport or even the school facility. And that's why this human capital development index goes beyond pushing just making available the healthcare facility or the school to actually pass rates, quality of teachers, and, you know, even healthcare outcomes, life saved and all.
Yes.
So
let me allow you to, yes, yes, take a breath, take a breath, and bring in Dr. Abdul Wahab. I'm just curious. I'm just curious. You have actually told us, you know, some of the issues that are driving our HDI, you know, very low. But I'm looking at other variables, you know, that are responsible for this, and how are we dealing with them?
Yeah, so maybe just linking up with the question you
Yes.
asked in terms of, let's start with, you said subnationals are building airport, not fancy. But when you look at what is happening at the subnational level now, there are strong emphasis on those key elements of development: health, education. Primary health care now, if you go at the subnational level, you have a challenge even that has been introduced by the governors in terms of it's a healthy competition among the governors to see who develops his primary health care best. And so it's one of the priorities of at the subnational to strengthen primary health care. So, and if you have an improved primary health care, some of these indices around mortality, immunization, antenatal, all those ones are going to improve. And when you have an improved coverage of those basic PHC services, you're going to have a better health outcome. No. For instance, the issue of nutrition. Nutrition is such a very serious thing. When you talk of malnutrition, we are #1 in Africa. We are 2nd in the world. That's not kind of position that we want. But like what she's saying, from utero, you have some interventions that you need to do so that the first 1,000 days of life, all the key things are provided. And then you now make sure that the child develops in terms of his cognitive development, it's not just physical or structural, but the cognitive development is very also important. And when you now have a child that is well nourished, it becomes very productive, because malnutrition also affects cognitive development of the child.
So when we know all this,
yes,
what do we do with them?
So exactly, what this HCD program now is one of the things that the government is doing. What we do is, what are those high impact interventions that needed to be done? And so the HCD, what's the HCD team, what we are trying to do is to make sure that we scrutinize the plans of each of the 36 states, look at all these components, look at their health plan, look at their education plan, look at their labor plan, and make sure that all those high impact interventions that will contribute to improvement in our human capital development are part of what they are implementing, so that they get their priorities right. That's essentially what
talking about getting priorities right, Dr. Ahmed Abdul Wahab. You know, the standard of living is another major component, you know, that determines HDI. You're talking about the state government and all of that, but looking at the present reality, the policies of government, you know, targeted at, you know, for example, the fuel subsidy removal and all of that, and then not making arrangements or adjustments in terms of wage, you know, to be able to balance, you know, some of these shocks that some of these policies are bringing to the economy. But do you think that we're headed in the right direction, and you think the index would improve?
Absolutely. I think we're heading into the right direction in terms of trying to prioritize what I call this high impact intervention. First, now you now find that we're putting emphasis on primary health care. If you put emphasis on primary health care, which means you're going to improve coverage of these basic services, there's something that the government is doing, the issue of the insurance. The health insurance is such that somebody can be able to access care without paying at that point of accessing care. So that what you just want, if somebody is sick, he can just walk into a facility and then he's going to be able to get the kind of care that he likes. What the government is now doing in all across the state, initially we have a national health insurance that the federal government rolled out. Now across the 36 states, you now have state health insurance agencies, and increasingly you are now having more and more number of people getting enrolled into the insurance scheme. And I think the palliative that the federal government just rolled out, I think there's a component there that I think is 1 million or so that they also want to reach in terms of making sure that they have access to insurance. And when you have insurance, I don't know, you must have experienced it. If you're on an insurance, you just walk into a facility, and at that point, you get care.
Is it about insurance or about having quality delivered? You know, because again, the conversation now is, you know, revolving around what is being delivered, even when you're on this insurance. Looking at health as a case study. You know, you go to hospitals and those on insurance don't get the maximum health care like they should get. They get substandard drugs. They don't even get drugs in some cases, and it's not covering a lot of ailments. So, I mean, how does that really work?
That's an excellent observation in terms of it's not just accessing care, is that you want to make sure that you get the quality care when you get to the hospital. So while the government is rolling out insurance, parallel to it, you also have teams or agencies that are ensured that monitors the quality of the services. This thing is not something that will happen overnight, but you also have, like for instance, if you look at Lagos State have what they call HEFAMA, or they call it HEFAMA, that actually looks at the quality of the services being rendered. And then if you have a facility, they are not happy with the standard of service that is being provided, they blacklist it. So you also have states like Yobe. Yobe also have that same similar agencies. So these are best practices that not just having access to insurance, but also ensuring that the facilities actually provide standards. In fact, we have a National Health Act. The National Health Act makes a provision of a certificate of standards. That certificate of standards provides that a facility must meet certain minimum standard for it to operate. If it doesn't meet it, then you close it. So it's not just having access to any facility. So you have this issue of certificate of standard to make sure that the facilities actually, they operate at a basic minimum standard.
Sorry about that. Let me, Ruka, I see from your in designation, you have a lot to do with climate change, and we know that climate change now is really impacting greatly on our HDI. Of course, it's rendering a lot of people homeless. It's impacting our food security systems. It's also impacting our health systems and a whole lot of spillover effects and all that. So how are you dealing with this variable?
Yes, so like you noted, climate change is definitely one of the new elements we're looking at to realign HCD 2.0. And for climate action, it's really about adaptation or mitigation. And when you look at our climate vulnerabilities, like you mentioned, we're already having food insecurity and climate change exacerbate. So it means you have to adapt and introduce, sustainable agriculture. And that's why even agric would definitely be a major comment because of the implication on malnutrition. So we're at the phase where we're trying to identify what specifically to do, in the interlinkages of climate. And mitigation, for example, to improve availability of healthcare. You can imagine if you use renewable energy to power your hospitals, to power. When we had the labor union strike, I remember I was thinking if our healthcare infrastructure, the social infrastructure, was on renewable energy, off-grid solutions, the hospitals will still remain available. But then another thing we're looking at possibly doing is things around clean cooking, for example, which has linkages. So for climate action, it's really about mainstreaming and ensuring it's integrated into health, into nutrition, into education, and also labor force. I was just posting yesterday in Tanzania, this school kits they had for girls, because a solar powered school bag where the children can have lamps, but at the same time in that pack they have sanitary items for the girls, because when you look at out of school children for girls, a big reason why they're out of school is because they can't afford sanitary whenever they have their monthlies. And these are things we're looking at and ensuring we infuse it. The bag is solar powered, and then you can imagine if you get entrepreneurs to come and start making those bags. You also create green jobs, you create social jobs, So it's really, and that's why I was saying, the requirement is to ensure you have an intercalated plan that looks at all these and optimizes it. And for us at NEC is beyond that advocacy to convene, like the workshop where all the states nominated their focal points, they all came. And if you look at the breakout sessions where we're really discussing the details of what we should do along all these elements, you should really see the enthusiasm. That's why I'm very hopeful that the narrative will change. And sometimes it's looking at even the little things. You can imagine the implication, the impact of awareness on nutrition using local ingredients. What that would do.
I just asked a last question, and all these variables, that are adding up to HDI are actually goals, within the larger development, agenda, SDGs. And if they are scoring so low, I'm just, wondering whether, we'll be on target in terms of meeting some of those indicators, in the area of health, education, partnerships and all that.
Well, that's true. The SDG is just around the corner. It's 2030,
yes.
By 2030. So, and all these measurements are related.
Yes.
So it's just maybe, if you take SDG 3, was the one that you have health, you have all those other indicators under it. So if we don't do something, definitely we will not make it. Wow. But you now have different ministries now trying to bring innovative ideas in terms of how to address it. So they're very conscious that we need to meet these targets. So if you, for instance, I'll talk to you about health. The federal government, in conjunction with the state, launched the SWAP. So the minister is now driving what they call a sector-wide approach agenda. And that SWAP is just to make sure that both the federal, the state, and local government are aligned along a common goal. And all this thing is targeted so that we make sure, for instance, the minister, when you hear him talking, say he wants to crash maternal mortality. Maternal mortality in Nigeria is one of the highest. So if we are all aligned, because one of the challenges we have is around coordination. You have people doing different things, maybe duplicating or doing things at cross purposes. But the whole idea is this SWAP is trying to make sure that we have one single plan, we have one single project, we have one single report, have one conversation.
All right, talking about the one conversation, Rukia, before we wrap up the conversation, could you speak to us about this program, the HCD, right? That's the program? 2.0. What is it about? And then does it focus on, addressing some of the societal ills already created by our low HDI, talking about insurgency, talking about the societal ills and all of that, poverty and all of that?
Yes. So all these things you're talking about, the insecurity, poverty, is an outcome, a result of the HCDI and it being suboptimal. So definitely what this is trying to do is attack the root causes, address the root causes. And I think what's worthy of mention in here, speaking to the broader agenda, there is a regional ECOWAS HCD endeavor that, because West Africa bloc, ECOWAS bloc, is even worse than sub-Saharan Africa, where we're the lowest when you look at all the regional blocs around the world. So we're hoping that we align this HCD 2.0 with the global agenda. Now that SDGs is ending, there's global flourishing goals. That's the next thing that would replace SDGs. And it's taking
global flourishing
goals. That's the discussion, and it's around humans flourishing within the political context as well and all that. Because when you look at the insecurity, it's not only Nigeria. The world is having a political crisis with polarization in societies and wars and all that.
But we focus on Nigeria now. Do you have a way to monitor these 36 states you're talking about?
Yes.
Incorporating them. Do you have a way to monitor? Because sometimes they just come, talk, and give promises.
We do.
But so how do you intend to ensure?
So there is a stream that will be purely focused on M&E and data. And even there's a big team, and some of the donor partners, even ECOWAS, they have a regional dashboard. And we actually have other NGOs like this NGO called HCD Plus that is doing capacity building. NBS was part of the workshop. They are part of the stream. Is a very important stream, and it's the tool for us to use for accountability for the states, where we plan on measuring, each state, and then we are also there to help with TA when necessary, to convene and bring donors together with those states where they need support in this. So we're not only monitoring Nigeria, but we're going to monitor those areas and those locations where we need where the intervention needs to go. So we would be measuring. And
what's the behavior of the subnationals? Because most of the indicators are derived from the subnational. Yes.
So they are all in this in their part. So I'm actually from the Secretariat of Nigerian Governors Forum.
Okay.
So, and it's from the Office of the Vice President. So we work together so that just to make sure that we have this alignment. So the governors are fully on board on this. What she was mentioning, that the workshop that was done, governors were the ones that sent all their focal persons. All the states attended, and so they have now charted the course in terms of not just what we want to achieve, but how. And that's what the workshop was all about, how we want to get where we want.
By the way, is there a target for this? Like, say, 2-3 years target?
So we, like I said, it's a long-term framework. We're doing the 2.0. We're looking at those indicators again. and the goals to realign, because Nigeria was the pilot for ECOWAS, for example, and we are going to set a holistic target for the program, but we are looking at the high impact of what we can do in the next 2 to 3 years. But like I said, it's a very long-term result. Without immediate results and tangible results like infrastructure projects that you just do and you know, see. So
thank you so much, Rikia Rufai, Special Advisor to the President of National Economic Council and Climate Change. Many thanks for joining us.
Thank you for having us.
Of course, we also like to appreciate Dr. Ahmed Abdul Wahab, Strategic Advisor, HCD 2.0. Thank you so much for coming on Good Morning Nigeria today.
Thank you so much.
All right, so that's Good Morning Nigeria this Tuesday. Do have a great day ahead and remain tuned to the NTA. I'm Ian Ray John.
And I'm Claire Adilabo Abdul Razak. Bye-bye.